Hi everyone. This is Ellen Madono, and I'm going to take you through the first case and read it and then discuss it. If someone else wants to do this and can, I would really appreciate it. I'm not a medical expert, but I'm going to talk about it anyhow, and make sure. I just feel that maybe some people are having trouble understanding the case itself, reading it. So. First you go to the sidebar here and you open the case, and it's called Opacity of Symptoms because the patient can't recall them. They can't recall the symptoms. Paucity is a word meaning a lack. There's not enough symptoms. It's a word that Hahnemann used for this exact same kind of case. And Dr. Shahrdar did this case, and it's a cured case. The patient is a 37-year-old man complaining of chronic fatigue syndrome, CFS. The main presenting symptoms related to his CFS are general weakness that cannot be specified, feeling of lassitude in the morning, especially when he is still in bed, feeling of not being as intellectually competent as he believes himself to be, to have been before, general weakness of memory and weak concentration. All these symptoms erupted after a distressing episode of infectious mononucleosis, IM, when he was 17 years old. So this is 20 years later, right? He was 37 years old and now he's 17. He was 17 when he got infectious mononucleosis and he's 37 years old now. The details of IM cannot be recalled by the patient. He remembers that it was awful, reporting some general and typical features of IM. Okay, so this is a very common situation because when somebody becomes very weak, very sick, often they can't remember what happened. You have to talk to the family, but the patient himself can't remember the details because they were too sick. And furthermore, he's continued to be weak, right? So, although this is a case about mononucleosis, it's a very common reason to have a paucity of symptoms. Okay, continue reading. Other important symptoms appear after the infection IM turning point. Okay, after IM changed his level of strength. And these symptoms were cervical lymphedema, okay, swelling of the lymph nodes in the neck, almost always present and fluctuating in severity, so they weren't always the same. Lab tests regarding WBC, okay, white blood cell count, the number of white blood cells, ERS, I didn't look this up, I'm not sure what it is, are within normal limits. You have to look this up, okay? His TSH level is within normal but higher limits. I think this is TSH is a hormone from the thyroid, which has a lot to do with how much energy you have. We should discuss this in the forum, in the discussion. He is susceptible to recurrent pharyngeal infections, sometimes exudative, sometimes not. Now, what does that word mean? This is important. A mild throat pain is always present, which is sharply aggravated by talking. so his throat is infected because it hurts when he talks. He is warm-blooded. He's a warm-blooded person. He has no tolerance for warm weather. I always take note when someone is warm-blooded and weak because usually people get cold. It's a little more unusual to be warm-blooded, I think. Maybe you disagree. This is also a post-I am feature. He is talkative, loquacious, and anxious. Okay, he is a talkative and anxious person who craves walking outdoors, so he likes fresh air. Okay, walking greatly palliates his anxious nature. So palliates means he doesn't get well, but he feels better. Okay, so ameliorates. Case analysis questions. Now, after you've read this, these are the questions that Dr. Shahrdar would like you to think about, and these are the questions that we should discuss in our discussion. What central theme of the case should be the target of remedy prescription? Translate the signs and symptoms to rubrics and repertorize them. You should know the typical symptom medical pathologies. Look up each pathology. And we're going to talk about looking up here. And the infectious disease that typically causes it. What are the best possible remedies suitable for this case? Suggest 3 remedies. Okay? As he is a never been well, you have to remember this, NBWS, case of IM infection. How can our knowledge of IM help us to choose the best remedy? Okay. So he means that you better know what the symptoms of infectious mononucleosis are. Okay. So how would you go about knowing that? Well, luckily we're using a computer, right? So I looked it up, and Wikipedia, of course, had it. If English is not your native language, and this looks like a lot to read, be sure you read the beginning, and you see in capital letters, in bold letters, glandular, so it usually affects the glands, right? And it's related to Epstein-Barr, EBV. Now these letters, these kinds of letters, we have to remember because they're used in Dr. Shahdar's Repertorium Virosum. Okay, so it goes on to tell more. It's saying that, but so we wanted to know what the signs and symptoms were. And you find this fatigue and malaise and pharyngeal inflammation. And oops, this wasn't supposed to happen. Okay, it affects the liver, and affects the blood cells. Okay, so that's why he was looking into the number of blood cells. So 20 years later, if you look at this, the man doesn't have all the symptoms of infectious mononucleosis, right? And I wanted to know about that word exudative. Remember, he said that he had exudates sometimes. I don't know if it's important for this case, but, I didn't really know what an exudate was. And, well, I thought I should know. And so I looked up exudate and infectious mononucleosis. I Googled it. And I found this document. I mean, I got a list like this, right? Get a list like this. And this looks like something that's kind of easy to read. I would have a hard time reading medical reports, but this is something easier to read. And it caught my I noticed that many parents believe that pus on the tonsils or white pus pockets is a sign of strep throat, and this is not true. Okay, this isn't going to help us exactly because this is not strep throat, but we're not really talking about a disease in the, whether it's strep throat or what it is at this time 20 years later when he gets these exudates. So anyway, I wanted to know what an exudate was, so I looked it up on Google Images. I mean, it just sort of helps to know what it looks like. Here's a really nice picture. These are all different kinds of exudates on the tonsils in the throat. Okay, so if you were to look at somebody's mouth who is sick like this, you might find these kinds of things. And 20 years later, I mean, these people are probably in the throes of the illness, but 20 years later, they might just have a little white mark here. It might not be so obvious, I would think. I mean, I've had patients like that. Okay, and let me see something else I looked up. Oh, this isn't just a infectious mononucleosis case. It's a post-infectious mononucleosis case. And so I looked up post-infectious mononucleosis. I mean, that's exactly what I put into the Google search. And I came up with a bunch of things. These are these are like medical studies, and they would be hard for me to read right from the beginning, but this one wasn't so hard to read. And the one thing that I noticed in this description was that this post mononucleosis time is supposed to be 6 months or something like that, but it says that it can affect a person their entire life. And so, we may have that kind of case, right? Okay, but what's important here? How do you repertorize it? Okay, so how do you repertorize it? So, first, what is the target? What's the theme? What's the central theme? When I just began, I just went through this case and took one rubric after another, and I felt lucky that I could find a rubric, but that's not going to be very helpful here. And so first think about your target. Okay, what is it you're targeting, and which of these symptoms is going to be really important? Okay, don't go on to the next lesson, but instead go up here to the discussion and open up here and read what other people are saying. I mean, Jim Herbert is the only one who's talking to Shahrdar here. And Shahrdar is kind of our old-timer homeopath from India. He's really a good guy. I'm so glad he's on our team. So look and read and think about what other people are saying. Reply to them, and aim your questions at what really bothers you. You don't need to be good at this or an expert. Jim seems to have quite a bit of background, but you don't have to. And just ask questions based on where you are and what really bothers you. I wouldn't right away start throwing in rubrics. First, decide your strategy, and then start repertorizing. Okay, that's as much as I can do right now. Give me some feedback. Tell me how I can improve this. Bye-bye.